introduce myself and tell you how much we appreciate the EMA and all of you coming here today to work out whatever it is that you need to benefit the residents of Indiana County. We have a real proud school. We're proud of everything that we do here, and we are certainly proud of the service that each one of you bring forth to your communities. So whatever the results are as you move forward, we just want to say thank you for your service. We are all in the service industry. My goal is to serve the children so that they become great community leaders such as yourself. Your goal is to serve your communities and make them proud places to live and raise a family. So thank you very much. With that being said, it is a service meeting and we are all in municipal government. If we could please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And with that, I will turn it over to Commissioner Keith, and I hope you have a great evening.
Good evening, everybody, and thank you for joining us. It is no small feat for our municipalities to join together to solve a regional problem. That is why we're here tonight, to solve a regional problem, one that affects all of us and everyone who is important to us. As you'll hear during tonight's presentation, together we need to build a better EMS system for Indiana County, a system that will provide a high level of service at an affordable cost on a sustainable basis. And I have actually said that 5.5 years ago, starting this from day one. A group of volunteers from our communities have spent many months and countless hours studying this issue and discussing solutions. Collectively, they have arrived at a proposal for the best path forward to include Citizens Ambulance as a provider, which representatives from Citizens are here tonight. Now it is time for all of us to take the next step. That step is allowing the formation of a regional municipal authority with a representative governing board that can drill down into finer details and bring those details back to your municipality for consideration at a later date. To be open and clear, tonight is not about exact cost. Staffing levels, station locations, those details only can be ironed out if the proposed authority is created. And that's what we are here to do tonight. To lay the foundation for an authority. Municipal leaders, if creating the authority is not supported, this effort stalls and communities remain at a risk of losing emergency medical services. But by voting in an affirmative, you can ensure your municipality has a voice in decisions and the opportunity to be a part of the next step to solve our EMS crisis. That's what tonight's all about. EMS is an essential public service, has always been and always will be. It is my hope that as a community, we are going to leave this room tonight having taken the next step to make sure that our EMS will always be available when you or a loved one is needed. Thank you.
Evening, everybody. Thanks for coming this evening. My name is Rob Brady. My firm, Rob Consulting, was the group that was hired to coordinate everything on the consulting end, to work with the steering committee, the commissioners, the elected officials, yourselves, anybody who wanted to participate. So this evening, our agenda is pretty simple. The welcome. We're going to do a community presentation of what we know today and try to give you as much information as we can. One of the big things that we want to make sure is we've heard a lot of different rumors. Last night we were able to answer a lot of questions from folks. We had a good, healthy debate back and forth, answering questions, and our goal is to do that this evening. And then once we're done with that, then we're going to open it up and have the special meetings for the municipal ordinances. So we're going to keep this moving. I'll switch over to the next part. All right, so tonight the vision is, and the purpose is to give everybody the opportunity to have a voice in what goes on going forward. And this is your opportunity to participate, okay? We want you to understand that. Voting on an ordinance that will ensure your municipality has a voice in that decision moving forward. That's what this goal is this evening, to get to that point. So as the commissioner said, we can drill down even deeper to the next steps and build more of a plan out, okay? So as we go through the process, when we looked at stuff, so there's three things that we really see that are impacting. The voluntary subscriptions are declining, whether you call it an ambulance solicitation, a club membership, or whatever you might call it colloquially, regionally, or whatever. These are declining everywhere, not only with Citizens, with LifeStat before they closed. Every place we go, it's a significant decrease year after year. Okay? The other thing, whether we like it or not, is the increased cost of services. Nothing is cheap anymore. So every year they're seeing price increases. One service recently told us that their insurance costs for their staff went up 22% for 2025. So don't be shocked by those kind of prices from your fire companies, getting stuff from their insurances. It's just the nature of where we are. And EMS is taking a hit more significantly in a lot of ways. And then the other thing that we really wanted to make sure everybody understand, there's a concept there out here called readiness for service, okay? Insurance only pays a small part of the cost of the delivery of EMS service. Essentially, insurance covers that call. What we're looking is to try to create the authority to have a funding mechanism to come up for the cost of the readiness of service. That's the staffing, that's the buildings, that's the apparatus, all the equipment they use. To pay for that when there's a downtime, when they're not out running calls generating revenue from from insurance reimbursements. And so everybody knows there is a lot of downtime with emergency services. And then there's a lot of times that you can hit 3, 4, 5 calls in the same municipality within a 15-minute window. It's just the way the system works. So these are the big three things that we want, you know, why the system is at risk, and the need to look at additional funding. So in Indiana County, of course you have the 2 or 3 ambulance services that provide services on some outer municipalities, but the large part of the county is provided by Citizens Ambulance Service, and up until December it was provided by LifeStat when they shut down. Okay. Subscriptions, we got good information, and to give you a rough idea, essentially since the time period of 2013 to 23, the subscriptions across the board have decreased 33%. So every year there's a decrease in the amount of people that actually buy the voluntary subscriptions from the ambulance services. And that's key to remember, that these are voluntary. And unfortunately, whether we like it or not, a lot of times people get these, they look at it, and they throw them in the garbage. Okay, so that is one of the things, and this is traditionally, how many guys are firemen as well in the room? No, those who want to admit it. All right. We know what it's like. If you did a solicitation, a lot of times you never got 100% participation. You got a lot less than that. So these are the things that we're looking at. So municipalities in Pennsylvania back in 2008, the municipal codes were changed. They were revised. So the first-class township code, the second-class township code, the borough code, and the third-class city code was revised. That actually says it's the responsibility of municipal government to delegate the provision of fire and EMS services. And this evening, the reason for this is to create the authority and to pass this ordinance to authorize that, and you're delegating that delivery of that service to this other entity if you choose to participate. And that's what the purpose is. But by law, it's in the municipal codes. We wanted everybody to understand, what the provisions are today. So we're working with a lot of municipalities. We've had from the steering committee to now the district reps. We have had very good participation. I had the opportunity, it was good to catch up with a couple people that I haven't seen for about a year. There's one or two other ones from when we started this about a year and a half, year and 3/4 ago, to collectively come together, the boroughs and townships, to form this countywide system, okay? I will have to tell you that I get to work a lot of different places. I get to work in a lot of states. This has been a really good group of people. Have we always agreed? Positively not. All right? I'm going to be brutally honest with you. If you think it was all hunky-dory all the times, there was times we had words. But we typically, at the end of the day, came to a really good, better decision and a better plan to get us to the next step. So kudos to everybody that has helped. So the process that's led us up to here, so in 2023, the county commissioners decided to organize an initiative to start talking about the crisis in EMS. And we're not alone. It's all across Pennsylvania. It's in every state of the country. The public safety system is challenged on a lot of different levels. A steering committee was formed to start talking about what the possible options are and what the possible solutions are to try to make it better in Indiana County. Steering committee was formed. As through the discussions, the concept of the authority model is what everybody landed on that made the most sense to get the funding. Kept working forward to develop that framework of that preliminary framework of what we thought would work for everybody in Indiana County. That's what got us here to this evening. And then, with the votes, if the votes in the affirmative occur, we're going to continue through this process, and the next thing early this year is you guys enacting the ordinances to delegate the authority to the county to set up the countywide authority, and it'll be a public hearing at that point in time. So that's the next two steps. What is an emergency services municipal authority in Pennsylvania? They're established in accordance with the authorities law. Most of you are pretty familiar with that being elected officials. The concept is to manage and fund EMS 24 hours a day, 7 days a week, so that when the call to 911 comes in, that the service, citizens that we're working with, is going to be able to respond with quality people, quality equipment, all that kind of stuff that they need to make whatever problem they're going to get better, okay? That is the ultimate goal, to provide the highest level of quality, and they do a heck of a good job today. We're going to continue working with them. Dave Piper's here, if there's any questions later on. It's been good to work with the folks there. They're going to be partners in this, okay? Just so everybody knows, they are going to be partners in this. Nobody's getting fired. We've heard that staff's getting fired. We're going to replace everybody. We're doing none of that, okay? They're going to be a partner in this delivery of service, okay? This is municipal led. It's going to be led by you folks through that district representative process that we established. It's going to be accountable and transparent, okay? I'm a little bit of a guy, some people tell me I'm tight. One of my best friends from college says I'm fiscally conscientious. I just like to know where my money's going, okay? So this is going to be a transparent concept. I mean, it's going to be public meetings. Stuff can be requested if you don't get it, if you don't like something, if you think right to know. It's going to be under sunshine law. They're going to be all public meetings. They're going to be that kind of things. And of course, these district reps are going to be your voices back to what's going on here. And the goal is to cover and protect everybody in Indiana County. Residents, visitors, college students, businesses, their employees. This is a representative system that takes care of everybody. So. Okay. So one of the people asked, what is a good model? So we were lucky enough to be hired a few years ago, 2021, to work with folks in Lancaster County, which led to the creation of MESA, the Municipal Emergency Services Authority of Lancaster County. Okay? So if you're familiar with Lancaster County, they're up the 283 corridor, going from Lancaster up to Harrisburg. They're right below the Dauphin. They go up to the Dauphin County line, Elizabethtown, trying to think of the other borough right there. Mount Joy, that corridor of 283 is where their service area. So they cover 6-7 municipalities. That northwest corner, publicly funded, $85 a year. Okay, that's what their annual fee for a residential use is, $85. First year was $85. This year for 2025 is $85, and they anticipate, looking at their numbers, it'll stay the same for next year. Give everybody a rough idea for what a residential. And then there's other categories for different types of uses that there's a different fee structure, but for the residential, theirs is $85 is what we were able to get it down to. They provide 100% BLS and ALS service with 6 units, and a paramedic chase truck is what they do at their max staffing, 24 hours a day, 7 days a week. And there's some possibilities this year in 2025. They've reported to us. Jason is constantly engaged with them on doing a couple things, but there may be a possibility that 2 more municipalities may join the authority this year. So this is a good example. I know we had at least 1 or 2 people who have visited this group and talked to them, and it's a good example of what's going on. Another one recently that switched. There are other EMS authorities in Pennsylvania. There's 8 other ones, just so everybody knows. Okay, they're mostly in central and western Pennsylvania. Ross Westview in the North Hills last year switched over to this model as well. Okay, they switched over to where they redid their articles of incorporation, which gave the authority the ability to raise the money on themselves, and they're operating the same way as what we're proposing here this evening. And there's several other ones across the Commonwealth that are looking at that option as well. So the benefit to everybody, sustainable model, whether, money makes the world go round. And we'll talk about the deficits that both of the ambulances are experiencing, what the cost of those services are, what their budget is. We know people want to hear that. We got that information for you. But we want to make sure it's sustainable, okay? We want to make sure it is ready 24 hours a day, 7 days a week, available for you, for everybody in Indiana County. Once again, this is local. That's why we came up to that representative system. It's going to be accessible. Local planning, decision making, public meetings. We want you to understand that, because we've heard a lot of rumors that this is a super secret society. It's not. This is a public entity. So it is going to be very robust on the things that it can do and what it can't do, but it's to benefit everybody. So when we came up, we knew we couldn't put an entity together that had 38, 39, 40 people on a board. We knew that was going to be sort of cumbersome. So we went through and tried to come up with an idea to try to figure out some kind of good representation for everybody. So after hashing the idea around a couple ways, this is what we wound up with, okay? We came up with 10 districts that are going to represent all the communities in the county. Those representatives, you've all picked somebody to represent you to this stage. And as you can see, this is the way it's broken down. But so far, it has worked pretty darn good. We've been pretty impressed. This is a large group, and it can be difficult to make sure everybody was heard, and we wanted to make sure it was representative, and we feel this is probably the best model for a group this size to be able to do something like this. So, these are the people, your fellow citizens, some former fire chiefs, some ambulance folks, municipal folks. So District 1, Augie Santini, District 2, Terry Pierce, District 3, Sandy Waldenville. I think Sandy's here, right? Yep, Sandy's back here. Did Terry sneak in? He wasn't here earlier. I don't think so. Okay. Jeff Gromley's work, he's actually child duty tonight. He wasn't able to make it. John Kravetsky, up here in the front. Danny Sacco, where's Danny sitting here? Nick Brillhart, over there. Let's see, Chris Anderson, did he sneak in? Nope, Chris did not sneak in. Bill Simmons, sitting right up here, and Mike Keith, sitting over here. So the concept, the board structure would be those 10 people. Each municipality will have that voice in the management and everything involving, and 2 members at large. We're not quite sure what those members at large are yet. Got a couple ideas, but they're going to be representative of the community as well. So it could be a business person, it could be somebody like that, we're not quite sure. Some of the ideas are probably maybe 2 business people sitting on it, so that's sort of the concept. But once again, the authority isn't formed. That's the purpose again for last night and tonight. Then there's some more of those higher, detailed, driven down decisions can be made. So people, ask, what is the services? Essentially, everything that Citizens does today is what's going to be continued under this process, okay? So they're going to be doing the advanced life support, the intermediate life support. They're going to do the advanced life support, paramedics, BLS, for those of you who don't know, that's the EMT level, okay? The intermediate, there's an intermediate or advanced EMT position. Advanced life support is paramedics, and in some cases, potentially pre-hospital registered nurses, higher level. So a couple different options. That's the kind of services. Taking the IRP program that's been around since day one, essentially, and revamping that, getting more involvement, but continuing that for a quicker response in a lot of cases, especially if there's a lot of call volume and ambulances are tied up, looking at that. The critical care services, the interfacility, and that's really taking care of if the hospital is backed up with patients. There's a real simple process so everybody knows. If their beds are full, they can't take anybody in. So a lot of times there's sick people in there who need to go someplace else. When we looked at the data that the hospital gave us, there is a huge need to continue the relationship where Citizens provides those transportation and ALS services for critically sick or injured people to a different hospital system. It could be into the Pittsburgh area, it could be somewhere else, but whether it's neonatal, whether it's a trauma thing, something like that, those services are going to continue. Community education and training, two things that have been really identified is, well, there's really three. Continue things and advance doing additional things like community CPR for everybody, doing the Stop the Bleed program so people understand basic first aid when a bad trauma occurs. And then, of course, some of the simple stuff that they've been doing, and it's not really simple, but some people say, but it's extremely important, car seat checks, car seat installation, doing those kind of things that are doing. We envision all that stuff is going to continue and potentially even get better. So, and see what other kind of opportunities that can come out of that. And of course, the community engagement stuff. All those things that they do today, like going to the county fair, going to local fairs, going to standbys for sporting events, figuring out how all that is going to fit into the system is what we envision and what the system is going to provide to all of you. So, okay, so when we put the questions out, and we got a lot of very similar questions, so we wanted to hit a couple of questions to give you an idea. So, the authority how it will be funded? It's charged to the property owner, okay? Under the authority's law, it would be charged an annual fee. Now, we're not going to lie to you. What's another word for a fee? I think first. Tax? Yeah, let's just call it what it is. In the authority's law, it specifically says a fee, so we got to call it a fee. But at the end of the day, it's a tax, okay? It's something to pay for this delivery of this public service for emergency medical services, okay? That board, once it's set up, as we dig more down into the plan, is going to determine what that fee is, okay? And we sort of envision it's probably going to be a couple different levels of fees. Probably for vacant properties, open space, residential, industrial, commercial, those kind of things, similar to what we developed in Lancaster County. So all of you know this is not the last step in your decision-making process. What you're doing tonight is to form the authority. Ben, the attorney I partner with, is going to explain to you the next couple of steps, because there's going to be additional meetings like this. There's going to be additional, one or two public hearings, and at the end, the final hearing is going to be the adoption of the final plan and what those fees are, so everybody knows. And then what we assume by the numbers we're looking at right now, that it'll probably pretty close to what the two ambulances charged for ambulance subscription is what we're thinking. But we have a lot more, like I said. Somebody said, well, we want the level of ambulance service that existed 40 years ago. And I think Dave probably 40 years ago, hi Rob, didn't see you sneak in, was probably about 7, 8, 9 ambulances running at a time, right, on duty.
We had 3 in Indiana, 2 at most of the substations, and then 1 at Hillsdale.
So typically 8 in service. And like we said, the level of service or increased levels of service will change that price at the end of the day. We want all of you to understand that. So the price will be reflective of what that level of service is into the community. So, I'm sorry, what was that, Dave? Yep, so. And then, at the end of the day, which was another big question, this will replace their voluntary subscription program, okay? Now, they may choose to, and we've talked about, they have an idea of possibly doing like capital campaigns every once in a while for major purchases, some other stuff. They're going to be a nonprofit corporation that's going to be allowed to do that. But this fee is going to really take care of that readiness for service. But those ambulance subscriptions, essentially, if this goes in, everybody's a member. So, yes. Question, if I already have insurance, yes. Goes back to that idea of that readiness for service, all that other thing. Your insurance is only paying for that little piece that you're using. It's the cost for the other thing. So yes, insurance only reimburses the cost of that EMS call, okay? It'll fund the balance, basically. It'll fund that balance. I'll answer a quick question, because I know you're going to ask. $2.2 million deficit last year, correct? Is that what we figured? Right. Right. Okay. So, and with LifeStat, their operating deficit was about $700,000. So, roughly a little over $2 million collectively. So, and just think about it, between when LifeStat was in service and Citizens, I think if I'm not mistaken, they cover every municipality except for 4, I think then, right? 4 or 5. There's some Puxy covers a little, West End I think covers somebody, and then Blacklick covers 2. So, but they cover. So what we estimate when we look at their operating stuff, to run ambulance in the county is about $9 million a year. That's what, when you add in staff and all that kind of stuff, to run it for the entire county is about $9 million a year. So everybody, that's our rough number. So, and these guys are really digging into finances, looking at some other things. So we're really looking forward to the opportunity to learning more to make sure that when we decide on that number, it's pretty much spot on what we need. No, if the annual fee is it billed to renters? No, it is not billed to renters. In accordance to, like I said earlier, it's billed to the property owner. Okay. Now it's the decision of the property owner what they do. Do they send it to? Do they increase the rent? They're leaseholder? That's ultimately the property owners. We had a discussion last night about 1 or 2 possible options in that. We're going to investigate that. But that is the property owner's decision on how they want to deal with that. So as I said earlier, these is Rob Walbeck's up here, Dave Piper. We're totally engaged with Citizens to continue them as the 911 ambulance provider. Okay? Some people said we're going to throw the baby and the bathwater out. It's not true. There's been lively discussions about all the possibilities, but at the end of the day, the best option was to use, and unfortunately John closed, but Citizens are around, and our goal is to keep Citizens alive. Okay? There's been changes with that, if Dave wants to talk about with the former management company, but our goal is to work with Citizens, and they're going to be the delivery of 911 services for the county. Okay? So, and basically what we're looking at is the authority would be the governance as a result of all you. Okay? It would be the funding mechanism, and you would provide the oversight. Okay? That's what it would be. We're not looking, so everybody knows, we're not looking that this authority is going to have 75 members, employees. There might be 2 or 3 at the beginning. Okay? There's a rumor that everybody who sits on the district as a representative is getting paid $60,000 a year. Just so you know, there is a rumor out there that Danny, you're a firecracker, you can take a heat. What are you going to do with your $60,000 you get? Okay, all right. Everybody's party, first hot day in July, we're going to Danny's house. But seriously, that's why we're here, and we ask when you get to this, the public comment, just be respectful of everybody in the room. Ask the questions if you heard it. We'll tell you. We'll tell you. And if we don't have the answer, once again, we're going to tell you we don't have the answer. But it is the goal And the board from Citizens has identified their willingness to continue to provide the service and work with us and keep them alive. So, I think at the end of the day, it's going to be a win-win for everybody. So, Jason. Yes, we're making this, repeating it a little bit, but there was so much misinformation. Yep, public meetings, right to know, sunshine, everything transparent, budgets approved at public meetings, all that kind of stuff, okay? No different than what you do for your own municipal governments. We encourage people. We had some citizens last night. We got a handful this evening. We encourage participation. There was even a discussion with this of maybe even creating some type of like citizen advisory committee to feel what the community actually expects from this ambulance service. Okay, so a lot of good ideas. And like I said, everything's approved at a public meeting. So. Okay, if it's not done, okay, we're not sure what's going to happen. Ultimately, like I said earlier, it's each municipality's responsibility under the municipal code to provide it to whatever however you want to. But it's about our families, not my families. All of your families, your friends, your kids, your relatives, even the relatives you don't want to admit. I know I got one or two in my family, but it's about all of you, okay? We want to make sure that the life-saving services that you came to expect over the years from Citizens continues. And even potentially with these ambulances that come in from the outside, if you vote to be participating, and you may get it from service from somebody else, we are going to entertain the concept of how do we deal with that, okay? So, we want everybody to know we've talked about that situation as well, but it's to do it long-term and sustainable. We don't want to see, within the last 2 weeks, 3 more ambulances have closed their doors in Pennsylvania. I can show you, I get news articles from all across the country. Finally, some people are stepping up to the plate to solve this. You're one of the few, unfortunately. We see more not wanting to do something, but you folks, kudos to you. So here's what's the next step. So based on what happens with the vote, probably in March, the way it looks, based on timing, and Ben will explain that, the articles to incorporate will occur, okay? And then sometime in the spring, the first meeting would happen. And then through that period, before that public hearing on services and fees, there's going to be multiple meetings with the steering district, which will probably be potentially the board members, to put and dig down and put all those other details that we're not quite sure about together. All that has to be done and developed, and that has to be part, as you can see, when that public hearing actually goes on the final plan and the final fee structure, that has to be all presented to the public and to all of you. So it will be a written plan, okay? You will all be able to, at the end here, there's a QR code, there's a website that was launched, that's gonna have all that information on. It'll probably be, we'll figure out if we get to that point, we're still in this process, but if we get there, there'll probably be paper copies available for those who want it. And then if everything goes well, Ben will explain then that there's a process of a 45-day waiting period. And if everything goes well, and if it's set up, sometimes towards the end of 2025, beginning of 2026, it will start operating, okay? But this is part of the process to continue down that road. So, Jason. So what we're going to do now, we're going to open this up. If you see with your agenda, we're going to open up the special meeting for each of the municipalities, if you have your agenda handy. I'm going to take care of that standing up here with Sonia. We'll work through that so none of you from your municipal governments just answer the questions. We're going to ask you if you're ready to open it. We're going to ask you to do a roll call. And then what Ben's going to do is he's going to go over the ordinance with you. And then we're going to do the public comment. And like I said, our goal is just be courteous, folks. I've done a lot of these. People said, how bad was it last night? They didn't ask me how good it was. Trust me, I saw a lot worse. And relatively, it went pretty darn good last night, I thought. I really did. We got a lot of good questions answered. So we're going to do that, and then we'll break into those each municipal, meeting, see what the results are, and then we're done. So if everybody's ready, we're going to start this process. Okay. Yeah. Armstrong Township. I know these two. Armstrong Township. Do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Yes? Okay, I see head shakes. Yes, okay. Since you answered yes, can you do your roll call? Who's here tonight? Can you state your name? Bill? Dan George. And Roger George. Pat. Okay. Thank you, folks. Okay, Brush Valley. Brush Valley. Brush Valley, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority?
Yes.
Thank you. Can you please conduct your roll call?
Okay. Myself, David Overdorf, Chairman, Cody Baroni, Vice Chairman, Sam Kerr.
All right. Thank you, gentlemen. Okay, Center Township. Yep. Okay, Center Township, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Okay, thank you. Can you please conduct your roll call, please? Okay, thank you. Good? I'm good. Okay. Okay. Creekside Borough. No quorum, you're bad. Oh. Okay. That's fine. Thank you for saying. Appreciate it, sir. Okay. Next.
East Wheatfield Township.
Okay, East Wheatfield Township. Gentlemen? Oh, okay. Sounds good. Thank you. Yep, do it at their next meeting. Okay, all right. Ernest Borough. Ernest Borough, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Yes, thank you. Can you please conduct your roll call? Nathan Coleman? Thank you, folks. Okay, Indiana Borough. Okay, Indiana Borough. Do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Thank you, sir. Can you please conduct your roll call? Yep. I don't know. All right. Thank you, folks.
Marion Center Borough.
Okay, Marion Center Borough. Ladies? Marion Center Borough, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Thank you. Can you please conduct your roll call? All right. Thank you, ladies. Okay. You good?
Yep. Plumville Borough.
Plumville Borough. Well, thank you for attending anyhow. Thank you, sir.
Rain Township.
Okay, Rain Township. Rain Township, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate administration of EMS to a county-created authority? Yes. Thank you. Can you please conduct your roll call? Good. Thank you. Okay, Salzburg Borough. Okay, Salzburg Borough, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? You're going to table it for at your own municipal meeting? Okay, great. Thank you. Shalocta Okay. Shalocta, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Going to table it? Thank you, sir. West Mahoning Township. Gentlemen, West Mahoning Township, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Okay, thank you, sir.
West Wheatfield.
Okay, West Wheatfield Township. Okay, West Wheatfield Township, do you call to order your special meeting for the purpose of deliberating the proposed ordinance to delegate the administration of EMS to a county-created authority? Yes. Thank you. Can you please conduct your roll call, sir?
Chairman Sean Baird, Vice Chairman Jerry Rittenhouse, Roadmaster Joe Scheller, Secretary Jimmy Scheller.
Okay. Thank you, folks. And everything? Okay. All right. Thank you, ladies and gentlemen. I appreciate this. Now I'm going to turn this over to Ben Reed. Ben's the attorney working on the legal part of this. He's going to talk about the ordinance, and we'll go from there. Thank you, sir.
Good evening. Rob slipped me a note a little while ago. Someone gave me this yesterday. Said, Rob, pass this on to Ben. Too much legalese, if you could tell him. It's like, I'll do my best to not have too much legalese here. So, for all 15 years of my legal career, I've worked closely with municipalities and authorities as part of my public finance practice, but I've created a lot of authorities, joined authorities, and rolled up my sleeves in that regard. And a big part of my career has been working with Rob Brady and his consulting company on fire and EMS mergers. I'm on the board of the Volunteer Fire Department where I live. I'm going to talk a little bit about the Authorities Act before we get into the ordinance, and I'll try to keep it brief. The Authorities Act has a lot of purposes for what an authority can be created and set fees, and it doesn't say fire and EMS. Now, that didn't stop quite a handful of authorities in Western PA to create EMS authorities, and they're providing services, but they weren't sending direct bills to property owners. As Rob mentioned, some are doing that now. But there's a crisis in the Commonwealth, and for years there's been a push to get Harrisburg, the legislature, to make a clear direct amendment to the Authorities Act to allow for this to happen, because the Authorities Act has a lot of mechanisms and powers in it that can benefit the community. But some colleagues of mine and I realized years ago that we looked at several sections of the Authorities Act and said, I think there's a pathway for a partial solution for fire and EMS and how to set up an authority that way and to be able to collect fees based on that to fully fund these services. And very pleased that we had the opportunity to put that in action in Northwest Lancaster County last year. And very amazing process, and I'll keep it real short there. It's working. Very happy to be a part of that. So the MESA model from Northwest Lancaster County, we were hired, and we're working closely with the county and with the committees that have been formed, and based on the feedback, we tweaked it, and what's been proposed is suited to what we see on the ground here. So the Authorities Act, I'm going to get to the ordinance very quickly. The Authorities Act, most people are familiar with it for sewer authorities, water authorities, a municipality, enacts its ordinance and incorporates the authority, it appoints the board, and then it's kind of off and running, and then the municipality makes its appointments periodically, but they kind of, sometimes there's crossover and board, the composition, but it's kind of hands off a bit. And they can send bills from day one, you know, the rate resolution, we're gonna set the sewer rates and you send it to people and you gotta pay. The mechanisms that we're using under the Authorities Act with some additional kind of belt and suspenders and accountability pieces that we put in it goes above and beyond in terms of the public opportunity to provide input and for kind of the checks and balances to make sure it doesn't go rogue. So following tonight, the county would be the incorporator of the authority. So the county has to advertise a hearing before it enacts an ordinance. It has to advertise the ordinance too. So there's a public hearing where people can say what they think about it. They can hear what the authority is going to be like before the county were to take action to incorporate the authority. Now, a big difference between this authority and like a sewer water authority is from day one, this type of authority can't be sending bills out. It first has to give notice of a plan for the service and the fees to everyone who would be impacted. And then there's another hearing where it's all laid out and you say, okay, the authority's incorporated, can't do anything yet. It can meet and do things, but it can't send bills out. Here's the plan, here's the detailed plan that we'll all have been working on. There's been a lot of work done today, and there's going to be more work done with all of you and your representatives on the district committees in the next several months. That's another opportunity for people to say what they think. And then there's a period where you can decide if you want it or not. The municipality can decide if it wants it or not. The property owners can decide if they want it or not. If enough people say no, then it doesn't go forward, actually. On a municipality by municipality basis, we don't want to have 3 municipalities say they're out and then it necessarily pulls everything down. I mean, you want to have the ability to go forward. So there's several opportunities for more public comment input before any municipality is really kind of on the hook or fully on board for doing this. But tonight's important because the ordinance that I'll summarize is one that overall signifies that you want to be a part of the process of creating this, with still opportunities to say, you know what, it's not quite what we thought it would be in terms of design or what the plan looks like. So there's opportunities to kind of not be a part of the process going forward. But we really need to know the municipalities that are in, and that's why enacting this ordinance is important, because an authority, with 36 municipalities, 38 municipalities behind it, creates the lowest fee structure that you can possibly have. Fewer municipalities are part of it. There's a tipping point. At some point, you can't do it. I don't think we're going to be there because we had a really great evening yesterday. But the fewer the municipalities they have, it makes it tougher to have the fees as low as possible, like we had in Northwest Lancaster County. So the first part of the ordinance is a lot of whereas clauses, kind of builds up to the operative sections. But one of the first things this ordinance does, if you're enacting it, is you're determining that delegating the administration of EMS to this authority is in your best interests, in the best interests of the community and businesses. And importantly, delegating that responsibility doesn't happen tonight. You're not saying, effective tonight, the authority is going to be providing service. The authority is not incorporated, so you still got to, the way your EMS is being provided now is the way it's going to be provided tomorrow. So you're not actually delegating tonight. You're making the statement that you want to delegate this to the authority once it's incorporated on a mutually agreeable date and time that's going to be determined as we keep going forward. The next clause talks about designating the entirety of your municipality as a service district. That's language that we pull from the Authorities Act to satisfy, the language that we're using to create the legal foundation for this. So as part of this administrative service authority, you have to designate a service district. It also authorizes the selection initially and on an ongoing basis of the members of your district committee. We feel really good about this approach, and we've seen it attempted in other places. There was an attempted York County Stormwater Authority that got very far along, and the foundation of it is that when you're going to have an authority that's serving an entire county, like Rob alluded to, we're not going to have a 38-member board. That's just way too unwieldy. But you need to have the community representation and input and the representation on the board so that it's run by you. And that's kind of one of the really cool things about this. It's a county-created authority, but we're going to build in mechanisms so that the county by law, is the entity that appoints members to the board, but it's going to appoint representatives from each district to the board. Okay? So you're always going to have a voice. And on those district committees meeting regularly, you want to make sure your board representative is representing you. You're saying, hey, I was at the board meeting last night. That's not what we talked about. You know, then you talk about it and you have your meetings, and then it really is a representative board. The final clauses of the ordinance are pretty standard stuff that kind of, there's like a catch-all that says if, you know, we really, you know, anything that kind of comes out of this that's not explicitly stated in the ordinance is approved. But again, there's always opportunities to go back and give other authorizations. So I'll leave that at that. That's the summary of the ordinance. And we're going to move on to the public comment period, and a couple you know, housekeeping notes. One is that really want you to try to keep it to 3 minutes per person. Trying to have a up to 30-minute public comment period, and an elected official came up to me before the meeting and made a really good point. This doesn't have to be the opportunity for elected officials to ask the questions they want to ask, because once we conclude the public comment period, we're going to go into the municipal deliberation piece where the elected officials of each municipality, one at a time, is going to come up and sit down and deliberate. You can use that opportunity when you're talking amongst your elected officials to ask questions that we can answer to, because we understand that, you know, just 3 minutes as part of your deliberation in a public comment period might not be enough. So at that, you know, the goal, the idea is that these are questions related to the ordinance. We understand that's difficult to kind of tailor it to that. So keep in mind that a lot has happened to date on this process, but the reason we're here, the reason we want to have this support through the enacting the ordinance is so that you can be a part of piecing together the final pieces of the plan to work out the details. So we'll open it up for public comment.
Good evening. My name's Nick Hemming. Some of you might know me. Some of you might know my background. I come here tonight to basically be a voice for the aftermath of what happens whenever ambulance services close. I come from 2 floundered ambulance services before, and one recently, Lifestat as well. It's rough on the municipality. It's rough on the people, and a lot of the questions that I've got asked before is, why did the ambulance service close? And the number one answer I've always given my people is funding. You know, if we don't have the funding to keep the doors open, to keep the trucks on the road, we can't do our jobs and we can't protect our communities. You know, I implore and I ask that all the municipalities sign into this as a stepping stone to the future. This is something that's brand new to the Indiana County, Indiana area, but I believe it is something that is going to provide funding and keeping EMS going within the county. One thing that I could come to and think of, you know, whenever someone calls 911, more often than not, an ambulance shows up. Well, now your ambulance is calling 911 and you guys are answering. Are you going to answer the call and help the ambulance services out? Thank you.
Arlene Wondotowski. I'm the mayor of Homer City Borough. My municipality was here last night and voted on the proposed ordinance. But I just wanted to let you know that everybody in the county, every household, every year receives a membership plea from Citizens Ambulance. And it's voluntary whether you want to join or not join. It's more or less a donation. They call it a membership fee. I send in my membership fee every year for the last however long that they've been doing this since I've lived here, and I'm happy to do it. It's more or less like a tax, but it's a voluntary tax. And just to let you know, and I need some clarification, I think the membership now fee is $75 and $65 for 65 and over. And that's per household, one household. You can have 10 people in your household, and you are charged just the one fee. And to let you know, Citizens Ambulance came to various municipalities last year, gave us a demonstration and of their ambulance equipment and how they're being funded, being underfunded by the insurance companies, and they asked for municipalities to donate some funding. And I believe out of the 38 municipalities, was there 5 or 6 that actually, 6 municipalities did donate money. So it's more or less a tax that we in Homer City Borough allocated $12,000 to Citizens Ambulance, and that worked out to $18.50 per taxpayer's money. And if everybody every municipal or every household would pay the $85 or $75 or $65 membership fee, we wouldn't be in this situation right now. And what's the percentage of return requests for membership? Is it like 12%? And that's low. I mean, for providing ambulance service. What was I going to say? I think there's like 650 households in Homer City Borough, and if everybody paid their membership, it would equal $45,500 from Homer City Borough to provide ambulance service. If our fee was $100, it would be $65,000. So you could either, households I think should either purchase the membership, or you're going to get taxed eventually if this ordinance goes through and if this authority is formed. So I would like to plead to the Borough Council officials and the township officials to try to get their citizens, encourage their citizens to pay for a membership for Citizens Ambulance. And I mention this every year when I get the request, and hopefully some people listen and do send in membership.
Thank you.
Okay, thank you.
Good evening. My name is Jesse Schatz. I'm a township supervisor with Washington Township. I was here yesterday. I have been pretty active with everything since I've been elected. As far as attending meetings, I've gone as far as even going out to Lancaster and visiting with the Lancaster team with what happened out there and spoke with them on the issue. I just want to send a message saying that what you're doing tonight is you're sending a signal. You've been getting a service for free for all these years, and it can't continue. It's going to cost now. This is a path you could take in that cost. It's not the only path. So taking this path, which I'm not saying it's a good or bad, it is what it is. And everybody that's had a part has worked very hard at it and very honestly at it. But in pursuing this path, you're creating another layer of an authority. The authority, you already have the authority. It's already in your code book. It's yours. And you can keep it. And you can make the decision. But it's not going to be free. You can go factory direct and deal with citizens. You can opt out of going factory direct, not have to put in the work, not have to put in the time, and go with this option, the authority. But this isn't factory direct. You're creating a middleman. You're going to have to pay the middleman and anything that they put into the layer that they're going to create of the authority. So there's not going to be, I don't know if there has already been mention of a number, but whatever that number is, it's like buying a mattress. You may have been getting a mattress for free all these years, but when you go to the mattress store and you pay $500, you could go factory direct and get the same mattress for $400. That's just an analogy. But either way, you're going to have to do the work. It is going to cost money. This is not going to happen for free. Are you going to ask for the money from the taxpayers, or are you going to let them get it from the taxpayers? You are on a board, you are on a council, whether that's your vote is either one of 3 or one of 5, whatever it may be. When you go to this, now you're one of whatever you are in that district. And then even your one district representative has just one voice on that board. You can speak louder with the authority you have and you hold now if you choose to keep it. If you give up that authority or you transfer that authority to this EMS authority, you're going to drown in the other voices. That's all I have to say. Thank you.
Hello, my name is Jim Gatsky. I got 2 questions, okay? If you opt out of this, what's your options? Is a township or a borough? Mike, maybe answer that. Somebody answer that. Because PSAC says you have to have emergency management, correct? So what's your options? Okay, what's that going to cost you, Orly? Okay, that's number 1. I mean, this is very easy, in my opinion. Okay. Number 2, if you opt out, okay, say I get a call to my house. I'm Center Township, I ain't going to lie. Who's going to pay for that call? Is Center Township going to pay for that call from the ambulance if I opt out as Center Township? Or is the guy personally going to pay for that call? Somebody answer that?
Yeah, you as the patient, if they would opt out, are going to pay the full cost of it.
Okay. The borough or the township, even though they're responsible for EMS, they're not going to have to pay for that.
What was that last part, Jay?
The EMS, okay, they're responsible for having the EMS, correct?
Right, yep.
If they opt out, why should I have to pay for it and not the township pay for it or the borough?
Right, and what this lady up here said, the option is for the municipal government to start their own service. If they don't want to use citizens, don't want to do it through the authority, they have the option to start their own service if they choose to, or get it from somebody else.
And you know what that'll cost anybody. So I don't see why you would even have an option here. That's all I got to say.
Thank you.
Any other comments?
Yeah, this is more directed to the lawyer there. PSAPs, I don't know exactly how it's written, but townships aren't allowed to, lack of a better word, go in business with the county. Is that correct?
Not familiar with that. You said go into business with the county?
I'm not saying the word I'm looking for is business. I had the paper and I lost it. But anyhow, it's something to the effect that you're not, a township's not to litigation with the county. Right.
come together, the authority or say-so or jurisdiction goes to the higher level of government. So, for example, if you were to mix townships with the county would have a say-so in the authority unless they gave it up. And the same thing if with state and federal. It's kind of like whenever you watch the movies and the FBI shows up on scene and they throw out the whole jurisdiction. We're taking the larger government body.
Yeah, I mean, I'm not familiar with that specifically. I think one thing to keep in mind is that, I mean, the second-class township code and the borough code are, I mean, it's not the exact same wording, but the responsibility or ensuring the provision of EMS is how you choose to do it. I mean, it's intentionally open-ended. It doesn't say that you have to, township have to actually provide it. I mean, historically, I mean, for fire service and EMS, I mean, there's been nonprofits often that are providing the service on behalf of the municipality, whether it's formalized or not in an ordinance. But there's nothing that would restrict a township from delegating the administration of EMS to an authority that is available to do it.
So then it would be county run?
County incorporated, but there's, when an authority is incorporated in Pennsylvania by a municipality, there's cases that have interpreted it to provide that there's like sovereign powers, there's independent powers that an authority has once it's incorporated. The incorporating municipality always has the ability to appoint board members, and there's other mechanisms it can use to exert some control, but once it's created, it operates under articles of incorporation. If it wants to amend articles, you got to get the permission of the incorporating municipality, but it's not beholden to the municipality that incorporates it. So there's a level of independence between the county and the authority once it's incorporated.
And then the township or the borough, they would do the billing?
No, I mean, the bills would go out in the authority's name. The authority sends bills. Now, whether it appears on this bill or that bill, or if for convenience it's combined with other bills, I mean, I can't speak to that. But, so it's not the township's responsibility to bill and collect.
So is it going to be a bill or a tax?
Well,
Call it what you want.
I mean, the Authorities Act doesn't speak in terms of tax. I mean, we can talk about practically what it means, but it would go out in a bill that property owners would be expected to pay if they choose, if they're a part of this. I mean, no one's forcing it on anyone.
All right, thank you.
Some questions in the front here, or comments?
Thank you. Good evening. My name is Pat Doherty. I live in White Township, 345 Debbie Drive. Do I have to give you all that? Anyway, the question that we have is this. So as it stands right now, whether I'm a member of Citizens or not a member of Citizens, I have an ambulance call to my house. My private insurance would cover a portion of that fee. Even if we do this authority and create the $100 tax, $85 fee, whatever we're calling it, I'm still going to get a bill, is that correct, for my ambulance coming to my home to provide that service. Is that accurate or no? Do we know?
I would ask Rob to speak to that.
Dave, would you like to explain how ambulance billing works to the audience, please?
Yeah, because I was raising this. So my understanding, the way Chris,
the way membership process works is the membership application provides protection above and beyond your insurance coverage, so that if you're a member of the ambulance and the service that we bill is $1,000 and your insurance covers $600, your membership covers the remaining $400 balance. All right. Now, we had a question yesterday, and I got to make sure that this is understood. If you have that call on the first day of the calendar year and your insurance coverage requires you to have a $600 deductible before their coverage kicks in, then the ambulance service is basically getting their money from you, even though it was submitted under the insurance. Does that make sense? Do you understand what I mean? And so it's kind of complex, but that's the whole benefit of the membership. And the complexity of this, obviously, is if the county residents have a membership basically paid for them to citizens, you're in essence getting that insurance.
Right.
Okay.
No, you're correct, Dave. So envision that everybody, this fee, AKA tax, whatever the price might be, like in Lancaster County it's $85, you pay that as a result of being part of the authority. Essentially, for layman's terms, everybody's a member of the ambulance.
Right.
Okay?
And this is...
Oh, I'm sorry.
Now, I mean, the predicament that we're in, and we explained this yesterday. So every ALS unit that we run costs us $3,200. All right. Our insurance reimbursement is about $600. So in the grim reality of accounting and checking for a profit, we need 6 calls for every ALS ambulance that we operate. 6 calls. And those calls have to be transported to the hospital. Because if we go on the call and the patient refuses, we get paid 0. Even though we responded, even though we intervened, if we don't transport, we get nothing. All right. And so that's the dilemma. And our big dilemma is some of our stations in our rural areas, we aren't servicing that call volume. And so, you know, we move resources and funding from the one ambulance service that's actually making money to try to subsidize those communities and substations that don't make money so that we can provide the service. The big issue is by adding an additional ambulance does not solve a problem. All it does is add additional cost, and we have to add 6 more calls a day just to cover that. Does that make sense? All right. I heard you in my ear. Did you find them? All right. So the membership is half the deductible. All right. So I stand corrected. So it's half the deductible. That's what your coverage is.
Right. And then if you would, whatever because you're still going to be doing billing to the insurance, if the patient has insurance.
Right.
Whatever your insurance pays, if there is a over amount that they did not pay, that is written off as a result of being
It's
part of
half.
it.
It's, right.
It's
correct.
half. Some
It's
places,
half.
and we have to also follow,
Half
just
the
so
deductible.
everybody knows.
Yeah,
there
and
could be
please,
some-
okay, yeah, I never like to answer a question I have 100% knowledge of. But the enticement of the membership is that part of your remaining balance is waived. That's our incentive.
Right.
Okay.
And then we also have to follow the rules of Medicare and Medicaid for billing, private insurance, those type of things. But Medicare and Medicaid are fixed numbers. So that ambulance call may cost $1,200. You may get a bill, but Medicare is going to give a flat rate for whatever that rate is for the Indiana County region, and that's what it is. And citizens or Lifestat or anybody else can't get any other
Yeah,
additional
actually, if
money.
I could borrow the application over there,
Right.
that the mayor of Homer City brought, we could get the specific number of what the membership buys you.
Okay, yeah. So, but ultimately doing this is that balanced billing, that extra part, is what that fee is helping to take care of. So, but we can't skirt Medicare rules, we can't skirt, Medicaid rules for reimbursement. We have to follow what that is. There are set rates for mileage reimbursement from insurance companies. There's set rates for mileage reimbursement from private insurers, just like it is for your reimbursement rates, your co-pays, and different things for your own health care insurance. We have to follow those rules for billing. Now, there.
A website about what the membership benefits would be. And so if your municipality buys basically a membership for each member, pays the fee or what have you, then you get the same benefits.
Any other questions? Oh,
Yeah, my name's Ken. I'm Holtz. I'm from East Wheatfield Township, and I have a couple of concerns. One of my main concerns is, we're all sitting here talking about $85, $75. Nobody really knows what the total cost is going to be. My biggest concern is there's a lot of people in Indiana County, not just in East Wheatfield, but in Indiana County, period. There are senior citizens living on $1,000 or less a month. Your school taxes are going through the roof. Just to put food on your table is going through the roof. $85 don't mean nothing to me. If there's a heck of a lot of people in Indiana County, it does. It makes a difference of whether they're eating good or they're not. That's why I didn't sign tonight. I didn't sign not because of for me. I feel every township has an opportunity or an obligation to have community meetings in your own township. How many people here tonight from East Wheatfield Township? Let me see it. One person. How many people are here from your township? We're making a decision. It's going to cost these people a lot of money. Maybe not a lot to you or me, but there's people, $85 is going to hurt. And that's why I'm going to have a community meeting at our fire hall as soon as I get it set up with our leaders and let them voice their opinions. It's not me. It's for the people. I'm making a decision that's going to count a lot of people. And my other concern is we're all here tonight, everybody, and I'm in for this. I was in the beginning. I'm having a little bit of questions now, but my biggest thing is, what happens if half of these people drop out? This is just a hypothetical. If half these people drop out, where's the cost going to come from? The cost has got to go up for the other half that's left. There's just no two ways about it. So if it's $85 this year, what's it going to be maybe next year? The following year, years down the road. And once we're locked into this, how easy is it to get out? They say all you got to do is opt out. I'm sorry. I think once we sign this ordinance, we're locked into it more than what they want to admit. It's not going to be as easy as I call them on the phone and say, hey, I don't like this anymore. These are the concerns I have. I'm here to represent my people in my township, and I think my people in my township should have a right to come to a meeting. If they don't show up, if there's only one shows up, I give them the opportunity. That's all I have to say. Thank you.
Thank you. And what's your first name again? I'm sorry.
Kenneth Umholt.
Kenneth. Yeah, so, and you bring up valid points. So one of the things we talked about last night, and we're going to, if this moves forward, we're going to look and see if there's a discounted price or something for senior citizens on a fixed income. We're going to look into that. Okay, so that was agreed last night, so everybody knows that we're going to look into that. And you're correct, the cost is going to be based on how many people are in. And now here's the other thing. If you don't want the cost to go up, and the two gentlemen from the ambulance in the back will tell you, then the level of service is going to go down. So instead of maybe having typically 6 ambulances on during the daytime, 5 overnight and weekends, you may wind up having 3 or 4 for the whole county. So if it is solely driven by the cost and the not level of the service, it is, you're right, it is going to be correlation. So, and that's why Ben said earlier, the more people involved, the higher probability the cost is going to be driven down. We probably in Lancaster County, if there was another 6 municipalities who were interested, who actually went along and at the end pulled out. Okay, so keep in mind, you're just taking action to authorize the county tonight to create the ordinance, okay? At the end, when that fee structure, all you can pull out at that point in time. That's what those municipalities did, and then that increased the cost for the ones who were still in. So if you want a true matter, black and white, we need to know who is potentially in at this point in time, and then we can run numbers to generate that based on the number of municipalities that are in. No, it could, we thought in Lancaster County we could probably, if everybody participated, we could have got it for $70 or $75 a year. But because people chose not to, the cost went up. Now what happened was is that we actually assumed that it would really substantially go up, and it didn't. It didn't. We were worried it would go up to about $90 to $100 for the starting, but it wasn't. We were able to tweak it, and like I said, working with some really good folks. They have good people running the organization. You know, another year of $85 for a residential use. So, yeah, you're right, and it is. Again, here's the other thing. This is pure democracy in action tonight, and what you are doing. So it is ultimately your municipalities, everybody's. Nobody's forcing you to do it, and you're right. So thank you.
Excuse, Rob, so, all right, so I have so here's I'll read it. The annual membership fee for citizens limits your financial responsibility by covering half, 50% of the uninsured portion of all local emergency ambulance services.
All right. Dave Overdorf, Brush Valley Township. I was given some questions to ask Rob, Ben, okay, from a constituent from the township here, and maybe we can get some answers. I know this is about the ordinance, and the questions are maybe ones that should be asked after it was approved and maybe at a next public meeting, from what I've been reading here, but I'd like to ask them anyway on behalf and get some answers or whatever, if you can. Will all the fees collected go to the ambulance service? If not, where will they go?
So it would part of the cost would be the administration of the authority. So what we're envisioning, going back to what we said, this is not going to be a blank check. So there's got to be somebody watching the proverbial hen house. So part of the money would go to probably, we're thinking maybe 2 or 3 positions for the authority, because Citizens is going to continue to do what Citizens does. They have operational people, they have billing people, they're still going to do that, okay? And we'll sit down and figure out what the services they are. But there is going to be somebody who's going to have to run the authority, and then somebody who's going to have to be responsible and make sure the accountability, because there's going to be what we're calling performance requirements. So if there's a level of service that says there's going to be, say we want to go bigger on day 1, and instead of going from 6 to 5, we always want 6 ambulances in service, then a larger amount would be probably needed to be collected, and it would go towards that operation. But we're assuming there's going to be a small percentage to take care of that overhead. Like I said, people were saying every single person, $60,000 were getting paid. That's not true. But assume, because we need to have fiscal responsibility. Don't everybody in the room want to know where the money's going and it's accountable and it's being used properly? So it's not collect the money and hand the check over. So.
Real quick point, and I think we didn't mention this yesterday, but the articles of incorporation that we're drafting that the authority would be following are very robust. And one of the things that we built in Lancaster County that we would do here is that if the authority wanted to raise fees by more than the cost of living, a certain percentage, it wouldn't be able to do that just with a majority vote of the board. It would have to have another fee hearing for the public to say whether they're going to approve it or not. The Authorities Act doesn't call for that. You don't see that in the sewer or water authority, but we're building it in here as a way of showing that it's not just you create the authority and it's going to run wild. So that's in there.
Okay, the second question, will the fee structure be similar to the Lancaster Authority, with townships having to pay a fee per household and per mile of roadway in the township?
That is yet to be determined. We don't know. Yep, later on, yeah. Yep. And that was something the municipal leadership decided that they wanted to do. So.
Will we know prior to the 45-day opt-out period what the fees will be and who has to pay a fee?
Yeah, you're referring to the fee hearing. There we go. Where, again, Authorities Incorporated can't send bills yet, but it can meet. Then it advertises the plan and the fees and all the details, and then there's a hearing there. So it's all going to be very detailed and on the table at that point. And then that's what begins the 45-day period that the Authorities Act calls for a certain, like a third of property owners say they don't want to be a part of it. That means that municipality wouldn't be a part of it. Or we've even built in the municipality can say, we don't want to be a part of it. We've seen the plan, we object. So there's a couple objection options there. That's the point where you can, you know, no obligations, you don't got to pay anything. You enact an ordinance that says we repeal the ordinance we're enacting tonight. I mean, you can clean slate, you can get out at that point. So, yeah. Yeah, you got your mic.
Yeah. Next question was, after the 45-day period to opt out, are there provisions to opt out after then?
Yes, but this is necessarily that we had to build into this to be fair to all the other municipalities that are part of it, because through that 45-day objection period, you want to call it, after that fee hearing, the authorities wouldn't be permitted to be signing contracts and buying things and, you know, having all these liabilities, you know, until after that period is run. So once that period is over, the municipalities or residents are receiving the services, bills are going out, monies, you know, they have contracts and things. It wouldn't be fair to everyone else if, say, 2 years later, a municipality says, okay, we want out, and they didn't have to account for their proportionate responsibility for some of the costs that have been incurred by the authority up to that point. So you can get out, but you'd have to calculate, you know, some of the liabilities that you might have to pay for to get out.
Okay, and last one, who will be responsible for the collection of any delinquent fees?
Don't have a good answer for that right now.
So what we did in Lancaster County, the county commissioners wanted to do it through their existing system, but since there wasn't a full amount of a large part of Lancaster County, a large percentage doing it, the Lancaster group had to hire people to do it. And they put it out to bid. We wrote an RFP, and they got a company that was doing the billing, the sending of the, preparing the bills, sending the bills, collecting the money, distributing the money back, and then doing the delinquency stuff. And then they were using a local company if it got to that point, okay? What we sort of envision here is to keep the cost down, use the existing systems that are already here in the county. County Tax Assessment Office, that kind of stuff. That, once again, the county commissioners have expressed that, yeah, if this goes forward, we're probably going to use the existing stuff. We'll be using on the existing tax bill at the beginning of the year, not separate, keep all those costs down. So it just makes sense. So to do that, we reduce all that the systems in place, just use the existing. And a question was asked last night, could we even use the county for one or two other things? We don't know. We got to figure out what, the gentleman didn't know what those one or two things might be. Just, you know, we'll cross that proverbial bridge when we get there. So.
I think we have time for one or two more.
Yeah. Yes, sir.
Well, if we only have time for one or two more, I guess as a municipality, we'll have time later. So if there's public at large, I would wait to ask a question to let them ask. If there's public at large left to ask a question.
Any other public thing else? Yes. We'll make sure we get to that.
Yeah, we'll get you. Anybody else? We'll make the time.
I'm just curious, what if 5 years from now, there's another company that wants to come in? Are we locked into Citizens?
Well, we don't. our hope is in 5 years, Citizens is going to be here providing the service, and everything's going well. I mean, that's,
Yeah, but you're kind of giving a monopoly.
well, do you, are
Well,
you,
but
well,
who knows, 10 years from now, maybe another person wants to come in and start their own business. Are we locked into Citizens?
I would assume, and Ben right, but there would be a process of amending the articles to allow a bidding process to occur. I'm sure.
Yeah,
you
because
could-
we're doing with no bidding right now, right?
No,
It's
that's
just
a-
Citizens.
That's a great question, and I mean the articles of incorporation aren't going to say that Citizens is going to be the actual provider of EMS for forever. I mean, there's going to be an agreement, some form of an agreement between Citizens and the authority that provides for the authority is going to be collecting fees, the authority is going to be providing the revenue for Citizens to operate for some period of time, but there's going to be contract to be negotiated. It's going to have terms to it. So I think it's a great question. You don't know what it's going to look like down the road. Certainly, there's not going to be the intention of swapping out providers every couple of years, shopping it around every couple of years. That's not the goal. So I think it's not possible to say that there could never be another provider in the community. I mean, I can't say that. I mean, we have a great one in the community that we want to work with right now.
Yeah, but, we're locking into something.
Well, what you're committing to is the authority sending fees, sending bills to properties at X amount of dollars. It's the authority's responsibility to provide the service, whether it's through Citizens, whether the authority does it itself, or whether someone else is doing it. So it doesn't go away if somehow, the authority has a role to do, so long as the municipalities have delegated that responsibility to the authority.
Yeah, I just very curious. Everything says Citizens. It doesn't say an ambulance service. It says Citizens. All the paperwork says Citizens, as though that's decided completely. But like
The ordinances don't say that either.
no, the ordinance doesn't. But everything else we've gotten so far
Right. And that's-
always has
that-
them, and there's. Yeah.
I have several questions. You said there wasn't a lot of time. Is it okay to proceed? Okay. One of the questions that we had from the Indiana Borough was a concern about financial transparency. I know you can't give an exact fee without knowing who's in and who's out, but can you give a target goal number? If the shortfall is $2.2 million, if every household had opted in at $100, you're well over the shortfall, and that doesn't count businesses or anyone else. Okay, so what is the target goal?
What we talked about, worst case scenario, it would start at $100 a year.
I'm not worried about that. I'm talking about what's the total.
Oh, the total, so put two numbers together. Their operating budget, we're looking at his deficit, we're assuming at least 3 to 4 million, because right now they aren't really budgeting a lot of money or have the money to buy the ambulances and that kind of stuff. So right now, the cost, say if they would replace 2 ambulances, the cost essentially is going to be about, depending on what style, but about $340,000 each. We want to make sure all those costs are put in there. We don't want to just do the basic stuff. We want to make their capital improvements. We want to make sure that building renovations, anything like that needs to occur, they have lease agreements. They got to make sure that lease payments are made. So we want to make sure the fee covers everything for that, for their operating costs. And it would be everything. It would be day-to-day, and it would be capital. So we're looking, I'm gonna say it's probably gonna be around 4 million, I think is what it's gonna be. But, as Dave just alluded, as of January 1st, they became a standalone nonprofit. The previous for-profit management company is no longer involved, and I will give these men and women who are involved credit for digging down to really get a better handle of what's going on. They still have work to do. So, but when you look at the numbers, how it's running today, I'm thinking it's a $3 to $4 million total is what we need to raise. Yeah, for a year. Yeah. And it could be less. It could be less.
Okay, so if we, at the end of this, set a fee, let's just use the $4,000 mark, or $4 million mark. Okay, and that particular year, because we're still getting, as people who may need the ambulance service, we're still getting a bill, we're still paying. Let's say there happens to be an excess amount of money that particular year. We've raised $4.1 million, 4.2, whatever it is, their shortfall plus operations of et cetera. And they don't need $4 million that year. They only need 3.5. Where does the other $500,000 go?
I would assume that this entity would deduce the same thing as the folks in Lancaster County. There would be a reduction then of what the annual fee would be.
Okay.
Yeah. So, and let's face it, folks, that would be a goal. Yeah. I mean, say if they get a windfall from a bequest from somebody, they get a grant for something, and that could adjust. We're not the ones that are going to be sitting on it, but we would hope that that is taken consideration, and there might be 1 or 2 years it would be reduced. We don't know. But, that to us is good business sense to look at all those possibilities.
Okay, thank you. The next question on that note is we have some concerns about the bureaucratic structure. What are the possible EMS management scenarios? What are the administrative costs and organizational structures to go with those scenarios? I think you've already answered this. I just want to confirm that. You had alluded to initially needing a director and maybe 1 or 2 support staff to do various tasks, and then essentially hiring an ambulance service. In this case, since we have one readily available, Citizens Ambulance would make a lot of sense cost-wise. So that's the basic structure of which you're proposing. I know nothing's done yet.
Right. Yeah. It's like, why throw out the baby in the bathwater? Okay. There's a structure in place. It would be pure craziness. Because if you threw them out, think about, we're talking about $10 million a year. This cost would be astronomical. We wouldn't even be standing here because it would be a no starter. It just makes sense to you citizens. So.
Okay. The next question I have then, when the board is formed, I believe you said it was going to mimic the 10 districts with 2 at-large. Is that correct?
That's the proposal right now. And
Okay.
Of course, that could change once we get it set up.
So our question about that is, that looked geographically similar, not population density similar. Okay, so basically that looks like the Senate, not the House of Representatives. There's population density centers that still only get 1 vote, when in theory their constituents are paying significantly more money of the total.
Just so you know, that wasn't the original form of the map, just so you know. Originally, White Township, Indiana Borough were 1 district.
That's way worse.
Okay. Just so you know. And then working with Bill and Chris Anderson, the report coming back, we would prefer we both had our same district, had separate districts. That's why you see 2 separate districts.
That doesn't necessarily alleviate that nervousness. Indiana Borough and White Township, to use them since we brought them up, have some of the higher densities of population, and their dollar amounts are going to follow.
Right, and what we did is we looked at call volume, because that's going to be a really, pretty solid, and what we tried to do is we plotted out like a percentage of what the calls were. So I think we have about a 10% slide. One section was really, yeah, Danny put the numbers we worked with. We got some numbers from 911.
Indiana Borough and White Township, according to the 2022 numbers that we got from Emergency Management Agency, accounts for 25% of the call volume. Everything else is 75%.
Okay.
So Indiana Borough and White Township, 25% of the total volume of calls that Citizens takes comes from those 2 municipalities.
I think you might be misunderstanding my question. I'm not concerned that more money would be coming from the borough because we have more people. I understand that. That's not my concern. Our concern was we still only get 1 vote and what then happens with that money. We're funding a large part of it with only 1 vote and then what happens to it.
it's a great comment. It's a great question. That's why, in part, it's not set in stone yet. I mean, we haven't. We have draft articles of incorporation. It's a presentation based on all the work that's been done to date. I mean, I think we're going to take it in. We're going to keep hearing the voices and see what makes better sense if this doesn't make the most sense. I mean, that's so. Yeah, it's not set in stone yet.
Okay, and I have one last question, unless other folks from Indiana Borough have a question, and that is, can you just clarify? And I apologize, I missed part of the answer because the gentleman over here already asked it. If we wanted to, I believe you said there's a 45-day opt-out period, in which case we just give notice that we're not interested at that point. After that point, are we passing an order? Again, I apologize. I think he answered this question.
Okay.
But if we wanted to pull out, and I remember the part about that we may have a financial burden to cover, but what is the process of leaving if we wanted to leave at that point?
Okay, so, I mean, you enact an ordinance tonight. Practically, nothing has changed. I mean, still, you're not saying anyone else is going to be providing service because you have what is here right now. We keep planning, we keep, the authority presumably is going to incorporate the authority. It's going to work with the districts to finalize the plan and the fees, advertise that. You have the fee hearing. This is where you're talking about. It's all out there. Okay, 45 days. If within 45 days from your municipality, a third of your property owners say, we don't want this, or the borough says, we don't want this, you're not going to get bills from the authority for the EMS service. You're going, assuming the authority is going to move forward, it's to be determined how you're going to get that service after that point, but, you might, as a formality, work with your solicitor and say, well, maybe just enact an ordinance to repeal this ordinance that said you were going to delegate EMS to the authority.
And then whatever financial burden may or may not be, then we can worry about
No, at that point, there would be no, because the authority's not incurring any financial obligations.
I'm sorry, I meant after that period.
Oh, so let's say you become a part of it, the authority?
Is it as simple as we pass an ordinance, there just might be a bill attached to it?
Yeah, well, that's probably a simple way to put it. Yeah, I mean, you can get out, but there would have to be a calculation of, okay, we have, X number of liabilities and you represent X percent, so you got to pay us a little bit of money.
All right, we have another question.
And as we will review the fields, annually we'll review, or every other year we'll review the fee structure. 45 days applies then too?
No, because the way, at least the way the articles are drafted right now, if there's you don't do a new fee hearing every year to reapprove the same fee structure, at least as the articles are drafted right now. So let's say the authority wants to raise fees by like 0.5%. The bylaws as currently or the articles as currently drafted say if a majority, of the board wants to raise fees by, a smaller percentage, it can do that. Okay. If you want to raise fees higher than the cost of living, CPI index, then you have to have a fee hearing to go higher than that.
And assuming if you're reducing the fees, everyone's just happier, so it's fine in that case.
Yeah, we didn't build that in. We thought that'd be okay, Yeah, so.
Anybody else have a question at this?
Okay. Anything else?
Hi, I'm Matt Schreckengoss with Shalakta Borough. So my question is, you said it's all going to be out in the open and everything else, but that's just the authority, correct? Whatever citizens does with the money after they get it,
No,
you're just going to pay
It's a
the
good
bill.
question. That's a great question, and that's not the case because, yes, Citizens is a nonprofit, and it's its own entity. It will remain its own entity, but it's going to be providing the service on behalf of the authority, pursuant to the articles and pursuant to an agreement, I'm sure there will be between Citizens and the authority. So there's going to be full accountability. I mean, the money doesn't go to them and then it's like, we'll give you a little summary at the end of the year what we did with it. That wouldn't be the case. For monies that are generated through this now, if somehow Citizens is coming upon money from other sources, then that's not sunshined and right to know as much, but anything that is generated from the fees that the authority assesses, full transparency, full accountability.
So then if they, they get to choose what they're getting paid. So if they decide they want paid absorbent amounts of money and then they just pass that on to you guys.
No, that's, I mean, I don't want to speak out of turn, but it's not going to have the freedom to do what it wants with the money. It's going to be under an agreement with the authority on how that is spent. I mean, there'll be the same way, a sewer authority or water authority has a budget that's looked at and approved and talked about in meetings, and what people are paid from the fees that the authority is assessing is going to be open to the public. There's a hand raised in the back there too. If you want to add.
One more. But after we approve this and it moves on, you can have all the hearings you want to have. All we can do is complain. It still comes down to a small room of people deciding if a change gets made.
True, but it's, 12-member board represented by the districts throughout the county, and each district is represented by a member of each of the municipalities that are part of it. So it's as much or more public contributions to how it's governed than I think you'd see from, just about any public entity you have out there, in my opinion.
Yeah, but like the gentleman up there said earlier, once we give away that authority, we don't have authority. This gentleman here, rightfully so, feels that Indiana deserves more seats because they have more people and they're putting more money into it. But as a smaller community, probably the smallest in the entire group, we won't have a voice at all. We're going to be washed out by 7 other people in our district that are going to be washed out by 12 more people up above that. At that point, we're so far down that we could scream anything and no one's going to hear it.
Yeah, understood. I think one thing to keep in mind is that the reason you do it on this,
Correct.
big
I'm just trying
scale
to
is to
figure out
keep
the
the costs as low as possible for everyone.
Jessica Frick from Indiana Borough. On that topic of losing our authority and the mattress idea, I think it's more everybody getting together and going to Costco and getting a discount on our paper towels, as opposed to there being a middleman that takes money out from the mattress. That's just how I see it. Someone can correct me if I'm wrong. But I did have 2 questions I think you would have the answers to. When the numbers were being drawn up and counted, were the districts drawn based on call volume, and also was IUP counted within Indiana's call volume, or were they separately counted, included or not included? Yes.
Did it include the university?
It was the university.
Yeah,
included.
we took it all across, total call volume.
And that call volume was then put into Indiana Borough's call volume. Okay.
Yep.
And all the district lines, were they drawn more or less to try and represent call volumes?
We tried to get an average, tried to get it close where there was an equal distribution of a percentage.
Okay.
That was what the attempt was.
Thank you.
Yep, you're welcome.
I just had a quick question. As a business operation, they're saying they're going out and making calls and not getting paid on calls they don't haul to the hospital. It's a losing proposition. My company won't send my truck out of the driveway unless you have me a $5,000 purchase order up front. If you're billing somebody, if you're going to their house, they're liable for the cost, whether you're hitting them with Narcan, which is probably most of the calls, and then they're leaving and refusing service, or somebody has a diabetic emergency, which is serious. It costs money for that service to be offered, and there should be a way to recoup that money. Otherwise, we're going to constantly keep flushing this money down.
Thank you.
I could say amen.
Right, but yeah.
January 1st, 2025, Citizens Ambulance became fully non-profit, which means all the money we receive, whether it come from municipal contributions, whether it come from memberships, whether it comes from an authority, every dollar we receive goes back to operations. All right. The board that serves Citizens Ambulance does it for free. All right. We are non-paid members. We do pay staff to bill, as you said. We pay our paramedics, all of those things, but every dollar we get goes back to operations, which is why the board in October made the difficult decision to buy out the for-profit, so there was no confusion that this is what we're doing. All right, and You know, I've listened to the talk, and Rob will tell you every time he says it, I always want to fight back. We've done this for 60 years. And we think we've done a great job. We want to continue that great job. That's why we're here. That's why we went full nonprofit, so we could pump every dollar that's generated into protecting the county. That's what we're doing. We're kind of like the United Way, but different. All right? The question you have is, when 911 dispatches an ambulance, we would love, no, I shouldn't say that. We go. There's no questions. Well, we go and we try to maintain a 2-minute response time during the day, 4-minute response time during at night. That's our mission. It's been our mission for 60 years. We want to continue it for another 60. But we need help.
Thanks. So is there any, we'll take one more of this gentleman right here, sir.
Thank you. Just a quick procedural question. My name is Byron Stauffer, Indiana Borough. Any municipality that did not participate in the advertisement for these 2 meetings, or does a hard no vote, are they now deemed out of this process moving forward, or how does that work?
I would say we're not viewing any tabling or no votes yesterday, today as any hard no's. I think our perspective is we want to keep working with you as soon as possible, municipalities, to get you to be a part of the process, to contribute to making this the way it needs to be. So, I mean, if this is like hard no, we don't even want to meet you with it, don't talk to us about it again, then we kind of, assess what that means. But I don't think we're perceiving any action or lack of action taken yesterday, today as we're giving up on you. That's not the perspective, at least I think. Yeah. Okay.
I'd like to comment. I'd like to make a comment right here. From the gentleman from Indiana County Borough. See, this is what I've been saying earlier. Now, and I see where he's coming from. He says that they have more population, they should have more votes. This is why we have an electoral college in the United States. If you start this, all your outlying communities, like East Wheatfield for one, will be dropping out. Because if we can't have an equal say with the big guys, then I don't feel we should be in it. I mean, our outside communities, like up in the north, down here in East Wheatfield Township, we can have another ambulance service come in. In fact, West End's in our township most of the time. So if you go that route, where we lose say in this, you're going to lose communities. That's just my opinion. It's equal for everybody, or it's equal for none, in my opinion. I'm sorry.
Okay. Thank you, everybody. So we're moving on to municipal deliberation. So we're going to call Armstrong Township up to the table here first, the elected officials. Okay. I'm doing the first one. That's it. Then I go over. Okay. So there is an agenda on the table with a suggested motion language to be read by one of the elected officials. And then there would be a second in order to open discussion. Just by making the motion and by seconding it doesn't mean that you're necessarily voting for it, but that's what brings it up for discussion. And then you would have a vote, and once you conclude your vote, then we would ask for you to adjourn your meeting so we can get the next municipality to the table. So if we can get Armstrong Township, if you could please go up to the table here and conduct your business. And once you conduct your business and close your meeting, assuming you've enacted the ordinance, we'd ask you to move on to the final table if you're able to sign the ordinance, at least partially sign it if your secretary's not here.
I don't know how to turn it on. Is it on? Here you go. So we can hear what your decision was, okay?
I have a motion to approve it.
I'll make the motion.
Make the motion. Was there a second to that, Dan?
I second.
Motion's approved.
She said it's still not working. Look at the bottom, is the green light on? Look at the bottom, is the green light on? Is the green light on? Talking to it? Oh, it's on, yeah.
You just have to talk close.
Whoa.
Sorry, I have no voice left.
Okay.
So if you just kind of hold it a little closer, you should get it. And gavel too.
The motion to second, you welcome to have any discussion on it? Then you have your vote? Have a vote, everybody vote yes?
Yeah, everybody voted for yes.
You all voted?
So we can help him.
So you all voted yes? Okay, so then you adjourn your meeting? Okay, so then adjourn your meeting, signers can come to this table.
Meeting adjourned. We need a motion to adjourn.
Motion to adjourn. Motion. Yes, approved. Okay.
Meeting is adjourned here. The ordinance passed, so Rob and Sonia. They're done.
Our next one's Brush Valley.
Brush Valley Township, please.
Now what do we do?
Would you like a special mic, Kate?
Way to go, Roger.
Come on, Dave. I want to hear you nice and loud.
Come on, Dave. Nice and loud. You can do it, Dave. I'm great.
Have Cody.
Yeah, he's probably better than I.
What's that? Yeah. Okay. Motion by Dave Overdorf to enact the ordinance delegating administration of EMS to a county-created authority on a mutual agreeable date. Is there a second? Cody seconded. We have a discussion. Any discussion? Sam? Cody? This time, all in favor say aye. Opposed? Motion approved. We have a motion for adjournment. Cody, second. Sam? All in favor? Aye. Opposed?
Thank you, folks. Center Township?
The young girls. I'm worried about that lady in the elevator. You know me.
Give you a little more room. Better.
Oh, you want me banging around a little bit? I'll get him to quiet down, maybe. Front page of the paper.
Ladies and gentlemen, if you can just, if we don't care if you mingle among yourselves, just try to keep it down a little bit.
All right, bring this meeting to order. We have a motion on the floor to accept this EMS authority. All right. Any discussion? You got anything, Jim? Paul? Vote on this. All in favor? All right. Motion approved. Motion to adjourn.
Thank you. Ernest Burrow, please.
Do I have to say it in
Call the meeting to order for Ernest Burrow. Any discussion? Is there a motion to accept this? Do we have a second? Oh.
He has to read it.
Read it, Frank, if you're motioning.
Okay. What?
You're supposed to read this motion by.
Okay. Motion by Frank Rosa to enact the ordinance delegating the administration of EMS to a county-created authority on a mutually agreeable date.
Do I have a second?
Do you have a second?
Nate, second. And then, all in favor? Opposed? Motion carried. Frank moves to be adjourned.
Who's next now? Oh, Indiana Borough. Okay. Indiana Borough?
That's all right. We won't be here that long, right? Jonathan, you did have a question, though, right? He had another question. All right, well, following the order, I guess. I just wanted to do that. Do I need it? Apparently I need a mic. I'm flattered. Calling the Indiana Borough Council meeting to order. Jonathan, you did have a question. Can we ask you another question?
Sure.
Please. Jonathan, do you want the mic or do you want to just talk? Well, he has a. Oh, yeah, my fault. Sorry, my first time. Never got to walk and talk at the same time. All right, do we have a motion on the table to do? I did already, twice, as a matter of fact.
Delegating the administration of EMS to a county-created authority on a mutual agreeable date.
Do we have a second? Second. We have a moved and seconded discussion.
Yeah, I had a question. I guess there's some lack of clarity right here on the goals of the service administration. So is one of the goals to expand service to the county-wide more directly? To be determined.
We would assume that the majority of the county will be served by citizens.
Okay.
No matter who gets in and gets out. So if
Well, that's to be determined. Yeah.
so if municipalities elect not to get involved, do we still provide service? Or
They can find their own, but they'll have to negotiate themselves.
okay, all right. I wanted that to be heard.
Or they can do it themselves and buy amounts.
Okay. Thank you.
Okay.
Is there any other discussion? Which case, we just want to do a roll call vote, since there's 8 of us. Dawn is here in spirit. I suck. Okay, that's what we're here today. Okay, in which case then, Nicole, well, I can do it. I guess I can't do it. Can I do it? Roll call vote? Okay, Devisor, yes.
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 You have to close it. Adjourn.
We adjourn.
Marion Centerborough.
Okay, ladies, Marion Centerborough.
Oh, it doesn't say what you're supposed to say. Oh, wait, yeah, it is. There it is. Yeah. Okay. On the microphone. Okay, I call to order the Marion Center Borough Council meeting for the adopting of the ordinance for the EMS authority. Do I have a motion?
I make a motion to enact the ordinance delegating the administration of EMS to a county-created authority on a mutually agreeable date. I need a second.
Do I have a second?
I second.
Everyone in favor?
Aye.
Aye. I now need a motion to adjourn.
Motion to adjourn. I second it.
We're adjourned.
I totally get that.
Rain Township.
Rain Township, please.
Yeah. Yeah.
This don't look like anything. That ain't something for us to read. Call this meeting to order. Do I have a motion to opt in with the EMS plan, the county plan? Any discussion? We having a make a motion to adjourn? Second.
Okay. Sonia?
One is West Wheatville Township.
West Whitfield Township, please. Sonia, can you get they'd like some more help, more education.
This will be the municipal meeting for West Wheatfield Township.
Nice to meet you.
Do I gotta say anything louder? Holy crap.
In terms of the meeting last night,
Okay, motion made by Sean Baird to enact the ordinance delegating the administration of EMS to the county-created authority or mutual agreement date. Seconded by
Adjourn, I'll tell you. But 17 said yes.
Joe Shetler. Open discussion. Any discussion, boys? Nothing? All in favor? Roll call, go ahead. Yes.
Jerry.
All in favor? Motion carried. Motion to adjourn. Thank you.
Okay, thank you very much, folks. Ladies and gentlemen, that concludes our business for this evening. We'd like to thank everybody for coming out. We'll be staying around here a little bit if anybody wants to chat a little bit, but thank you very much. We appreciate it. Which guy? This guy here. I think that guy right there with the hat on, that boss hat, he's got a good.
See you Monday.